Hey, good morning, guys. This is Dr. Brendan Cochran from Interactive Health Clinic, bringing you a proactive health booster tip, basically during these uncertain times, to get your immune systems in check and keeping you up to date. So one of the things I want to talk about today is I'm going to go back and hit a few areas about testing, blood clots, inflammation, and oxidative stress. So those are kind of going to be our topics today. So the first one that's coming up is testing. Remember, I did talk about this in a previous video. I talked about the nasal swabs or the stool PCRs, and I talked about antibody tests. Well, what we are finding, I did some research, and I found actually in Italy the same thing is happening what I reported last week, where they are repeat testing patients who have already gotten over the infection and have no longer have symptoms, and they are still testing positive. Just like I talked about with some of the patients we've tested here. And one of my concerns for you're sick, 14 days later, you're good to go back to work. We need to be very careful with that recommendation because we just don't know. And one of the things that has changed in Italy specifically is they have gotten rid of that recommendation now. It is now 28 days. Once you've come in contact, been infected, you have 28 days of isolation now, not 14, because a lot of people are actually still actively positive when they're testing them at 14, 21 days, and even maybe up to 28 days. So like I said before, 37 days of shedding is possible in some people. I've even seen now up to 40 days of shedding this virus. So Italy made the recommendation basically to say you need to be in isolation for 28 days now. What else did we learn that's new? Some routes of infection. So in our older videos, it talked about ACE2. It's a receptor site that allows the infection to enter your tissues or your cells. We also learned that there's a possible new mechanism for entry where it invades your T cells and it replicates in your T cells. And your T cells are basically the army that helps you fight the virus. So this is not good because we know one other virus that does this is called HIV. And what it does is it kind of cripples your immune system by infecting those T cells. So this is a newer theory that's coming out. We saw some reports of it now, and it is concerning. Now, the thing that we don't think is happening is it's not like a chronic infection like HIV. We have no literature like that. So don't think of it as being, oh gosh, if I get this, I'm stuck with it for life. We don't have any evidence to support that currently. We just know that there's another mechanism of action. So that's concerning. I talked about blood clots earlier in the week and a lot of inflammation with either your lifestyle or the specific virus causing increased blood clots, and that theory is getting stronger now. So the autopsy results on patients who have passed, they have looked in the lungs and seen, in fact, yes, there are a lot of different clots that are forming in the lung tissue. So we now know that the clot theory is pretty much right on, where we're getting clots in the lungs and people can't breathe. So this is changing how we intervene, meaning that we're going to need to use thinners, blood thinners, kind of like we use if a person has a blood clot in the lungs that comes from their leg. We're going to have to use some thinners before we do possible ventilation or higher interventions. And it's one of those specific thinners that we use with ozone when we do ozone treatments, like I talked about in another video, is heparin. Heparin is naturally produced in your body as a thinning agent. We use heparin within this treatment with ozone as well, small amounts of heparin. And one of the therapeutic ways we think that this type of therapy works is, yeah, you're getting ozone, but you're also getting heparin, which is thinning out your blood so you don't have the risks of forming clots. What are some other natural agents that thin your blood out? Well, two really easy ones: keep yourself hydrated and keep yourself moving. When you slow down and your blood slows way down, guess what? Things get more sticky when things are slowing down. So if you're sitting around on the couch being inactive right now, that increases your risk if you do get an infection of having more problems, versus if you're constantly moving, your blood flow is constantly moving and it's reducing the risks of having clots form. Other natural agents that can be taken as supplements: vitamin E is a natural blood thinner. Lumbrokinase is a natural blood thinner. It's actually found from worms. Nattokinase, which comes from fermented soy. You can actually eat natto if you like it. I don't like it. It tastes awful, but some people love it. It is a blood thinner. And then ginkgo, which most people think about for brain health and memory, it does have some blood thinning effects as well. Now, I'm not saying go on these things right now. Most of you, what you should be doing is just keeping yourselves hydrated and keeping movement and keeping your inflammation down, because then you have less likely a chance of getting any clots, either related to this illness or clots in general, since we know cardiovascular disease with heart attacks and strokes are the most prominent cause of death in the United States. So let's go in more to inflammation. We talked about that earlier in the week, and we said getting your inflammation down is key. Well, another specific thing I want to talk about is oxidation, or reactive oxygen species. So reactive oxygen species, you produce these naturally when you're fighting an infection. However, you get more of these if you're exposed to chemicals like petrofumes, diesel fumes, if you're exposed to acetone, if you're exposed to fried foods, if you're exposed to junk foods, you get more reactive oxygen species. Well, those reactive oxygen species, if you have too much of them, it's basically, imagine like inflammation. Imagine I need some of them to have an immune response, but if I get too many of them, they cause lots of destruction to other tissues. So the analogy I like to use is, imagine you have a fire in a fireplace. It's contained, it's working, it's doing its job, versus I have a fire that's burning my house down. The fire that's burning your house down is you that's, again, exposed to lots of chemicals and toxicity and eating lots of junk food, and your blood sugars are really high because you like Coca-Cola and McDonald's and fried foods and all that garbage that really inflames your system. When we have that happen, now, when one of those people come in and need to be ventilated, now let's think about this. And the reason I want to point this out is a colleague of mine pointed this out. I think it's a really, really big thing we need to look at. So there's an article I'm going to post below that actually says 80% of people that are being put on ventilation die. On average, the normal individual that has to go on ventilation is 40 to 50% will die. So with the specific virus, 80% is quite high compared to the norm. So something's going on that really is saying, hey, we're ventilating people and maybe we're causing increased death rates in these people. And if you think about this full biochemistry picture, like my colleague pointed out, and I totally agree with this, is if we put a ventilator down a person who is already very oxidatively stressed, has lots of these reactive oxygen species. Remember, those 90% of the people are fine and the other 10% don't make it out. Making it out are the ones that are obese and they have hypertension and they have diabetes. All these reactive oxygen species are forming. Now let's put a tube down your throat and increase more oxygen. Holy cow. That's pretty much like, let's take a fire and let's pour gasoline right on the fire, right? You just added more oxygen to a very oxidative state and it blows up and it then destroys the lung tissue further. So you're doing that and you have a lot of clots in the lungs. That basically is a very bad scenario. So the way I see this going to improve efficacy is we have to approach, okay, we got to thin this person out. We're going to have to use some form of thinning agent. The other thing is we have a lot of oxidative damage and reactive oxygen species in this current patient. So we need to do things like give them lots of antioxidants. And we already see this being done in some hospitals where you're getting vitamin C infusions. We see this also with low dosage of ozone can be an antioxidant because it primes your antioxidant system. Well, another huge one and the most powerful antioxidant in your body that you produce on your own is glutathione. Glutathione is produced in the liver. If you take Tylenol, which is acetaminophen, it decreases the amount of glutathione that you produce. So if you're a Tylenol lover or acetaminophen lover, you already know that you have low glutathione levels. So you have low antioxidant capacity. Bad news for you, right? Another reason why we don't want to take those things if you do get infected. Or we don't want to take those things if you get a mild fever, right? And we talked about fevers in an earlier video. So glutathione, well, how do I produce it? Well, you produce it by some of the foods you eat. Specific foods that are really high in glutathione are avocados, asparagus, milk thistle seed, and whey protein are very high in glutathione. And it turns out if we cook those foods, the reduced form, the active form of glutathione is reduced. So we want to make sure that we don't cook those foods if we want to get maximum glutathione content out of them. Other ways we can enhance glutathione is something called NAC, or oral N-acetylcysteine is a supplement. It's a precursor to glutathione. And in fact, oral NAC or infusions of NAC is called mucomist. It is used in the hospital to pre-treat people for having kidney failure based on a drug, like using contrast dyes for CTs. You can get this beforehand and it reduces the chances that you go into kidney failure from that specific dye. It can also be used to protect yourself if you're going into like a radiation area where you're going to have more reactive oxygen species too. So oral NAC is an important thing. N-acetylcysteine is a precursor. Now, if you want to go straight to the specific agent, we can also have you take glutathione. However, most glutathione out there is crap, right? It just doesn't get absorbed. It's broken down in the stomach. So specific delivery methods have to be used. Otherwise, you're wasting your money on the product. So the best one I like is actually liposomal glutathione, and it has to be a reduced form. So it'll actually say on the product, reduced liposomal glutathione. Any of these products, they usually taste very sulfury. So it tastes like rotten eggs. That's normal. That's actually the sulfur component in the glutathione. And if it doesn't have that taste, then it's a bad product and you're wasting your money on it. So I like reduced liposomal glutathione. Now, some people, they can't take that oral form because it either really tastes bad and they have a strong gag reflex, or some of the products use a non-GMO soy and they can't tolerate soy. So then my next step after that is actually a topical spray glutathione. And there's a pharmacy that makes that. I love the stuff too. I actually will spray myself and rub it in. It does smell a little bit, but it goes away pretty quickly. But it's a topical spray mist, and you can absorb it through your skin and see increased levels of glutathione. So those are two of them. Then the third way we get it is we can actually put it straight in a vein, or we can breathe it into the lungs, glutathione. Now, one of the things I would do if we're in the hospital situation is I would recommend that we either give it as a nebulized solution into the lungs or give it as an IV before we had to intubate a person. Now, why is vitamin C important, and why are we seeing results with people getting IV vitamin C? It helps recycle your glutathione. It recycles your glutathione, so it becomes active from an inactive glutathione. So I think some of the key things we need to think about if a person's coming into a hospital, best results are likely going to be, hey, we need to deal with this blood clotting issue. We may need to hydrate them. We may need to provide them with anticoagulants like heparin. And we also need to consider giving them antioxidants like low dosage of vitamin C or glutathione as an IV or a nebulized solution. Then, if they require ventilation, which they may not, you may shut this whole thing down because you've shut the reactive oxygen species down. But if they do require ventilation, now you have a lot higher chance that they're less likely to die versus die from the ventilator, because now you're adding oxygen to a setting that truly has a high antioxidant property. And those antioxidants, what they do is basically they take that reactive oxygen and they turn it into water. They inactivate that reactive oxygen into water. That's what they do. If they're not available, you have this reactive oxygen molecule running around and it's causing destruction not only on the viral cells, but also your good cells as well. So these are important things that we need to be we need to think about, and we need to use our brains in medicine. There are biochemical mechanisms for doing this. And I think, right now we're in a time where we need to be fully integrating and thinking about every possible treatment strategy, not looking for a magic bullet. That magic bullet doesn't happen in medicine. We see that, unfortunately, with chronic disease, right? If you're looking for that one magic pill or that magic solution, it doesn't happen. It's a full spectrum. So in some of my other videos, I talked about, we're looking for a vaccine. It's going to take a long time to get a good vaccine. And even then, if we get it, how accurate is it going to be? We don't know. How many mutations are happening? I'll report on it Friday more, but there is a study basically looking at 20 mutations so far of this. Not just 8, but 20. And the good thing is usually when something mutates, it becomes less deadly because the virus wants to survive just like you want to survive. So that's good news. The bad thing is when it mutates, it sometimes becomes more contagious. So remember, right now, we know that most people, so to break the fear, most people that are getting sick, that are ending up dying, have some pre-existing condition. So that's the 10%. The 90% are usually just getting ill and they're getting over this. But we do need to remember that those people that are getting over this are shedding it for possibly 28 to 40 days. So we need to be very careful if we are opening up and saying, hey, go back. We need to be very careful how we do this so that we don't put those people who maybe aren't investing in their health as much at risk. All right. So hopefully this is helpful, guys. Remember, share this. Please share this to one other person at least. I find that if I share this around, it's helping people. It's getting the word out. And if you like the content, please write some comments down below. Tell me what you want to hear more of, questions you may have. I post this also on YouTube, so it'll be up there as well. All right, guys, have a great day. We'll see you Friday.